LISFRANC joint injuries. The LISFRANC joint complex is located between the tarsal bones and the metatarsals at the midfoot, shown here. Named after the French surgeon Jacques LISFRANC de Saint-Martin, who served in the Napoleon Army, this location is quite common for midfoot pain, especially at the articulation of the first tarso-metatarsal joint, shown here. Sometimes such pain extends to the articulations of the second and third tarsometatarsal joints. A LISFRANC injury is often mistaken for a simple sprain. However, this injury is not a simple sprain and should be diagnosed and treated early. In fact, in any case of midfoot pain, LISFRANC's injury should also be considered. Injuries can vary from a simple injury that affects only a single joint to a complex injury that affects multiple different joints and includes multiple fractures, where it may take many months to heal and may require surgery to treat. Injuries are most commonly due to a simple mechanism of twist and fall, like tripping into a small hole, which causes a strong twisting force with the body weight on top of it. It can also happen in car accidents. In sport, it is commonly seen in football and soccer players. The clinical complaint and making the diagnosis. Symptoms include pain in the midfoot area with difficulty putting weight on the foot, hemorrhage or bruising on the bottom of the foot is highly suggestive of a LISFRANC injury. At the doctor's office, your doctor will examine your foot and ankle, placing emphasis on special tests such as the midfoot stress test, done by grasping your heel and twisting the front of your foot to determine whether there is pain at the midfoot. The piano keys test may also be performed, where the doctor will move your toes up and down to determine whether this causes pain in the midfoot. Usually, a simple X-ray is sufficient to make the diagnosis. But in severe complex cases, a CT scan will help evaluate the exact extent of the injury and the number of joints that have been injured. The treatment of LISFRANC's injuries. For simple injuries, conservative treatment consisting of wearing a non-weight-bearing cast with a toe plate under the toes for 6 weeks is usually enough, followed by a lower leg rehabilitation regime. For more complex injuries, surgery is required to fixate the bones with pins or wires.